We're hearing some health experts describing what we are facing today as a Category 5 hurricane. But that doesn't seem to make sense since half the country is vaccinated. Vaccines work. So are experts making too much of this surge in cases? They make it sound like we're going back to where we were last March. Is it a Category 5 for the country or just for the unvaccinated?
Well, you've got it right there. This is a pandemic of the unvaccinated, but that is still 100 million adults in the United States of America. And those numbers that you've just been going over are truly distressing. There's a world of hurt happening now in Florida, Louisiana, Arkansas, Missouri, that could have been prevented if we had simply been more successful in convincing everybody to have confidence in the vaccine to help them. It's heartbreaking now. These stories of people in the ICU saying, oh, I wish I'd gotten vaccinated. A final text message from a 39-year-old father to his wife saying, I wish I'd gotten the vaccine just before he died. Isn't that enough to wake people up? We know these vaccines are safe. We know they're effective. They work against the Delta variant, which has got everybody so concerned. So if you have been on the fence, anybody listening right now, this is the moment to step aside from all of the misinformation and, frankly, disinformation that's been put out there. Look at the data and then roll up your sleeve. Protect yourself, protect your family. Be part of the answer here, part of the winning team. You can't count on the vaccinated people to save you. You've got to become one of them.
But for those of us who are vaccinated, for the millions of Americans, is this devastating and distressing? Are we safe?
We are mostly in very good shape because the vaccine is very effective, and that includes against Delta. We did learn in the course of the experiences in Provincetown, Massachusetts, that fully vaccinated people are capable in some fairly rare instances of actually getting the virus, having mild symptoms or no symptoms at all, and then passing it on potentially to others, which is why CDC had to change their recommendations about masking to include us vaccinated folks if you're indoors in a crowded space, because you might unwittingly be passing this along. That just makes sense. I'm sorry if people think that that's a change in the guidance. Well, it's a change because of new data. Isn't that what you want your public health experts to do, is to look at the evidence and then tell you what right now is the best thing to do? And I guess I find it frustrating that the whole idea of masking has become such an emotional and, may I say, political situation. It's pretty straightforward, pretty simple. We know that masks work. They're not perfect, but they sure help. So if we have evidence that we need to put those back on again in certain situations, let's just do that.
But then let's stay on that, because I want to share what the CDC director said on this network 3 months ago when the mask mandate was dropped. Listen.
How sure are you? Because this feels like a really big change.
We're sure. There's an extraordinary amount of evidence now that demonstrates the vaccines are working in the real world. Importantly, there's also new data, just even in the last 2 weeks, that demonstrates these vaccines are working in against the variants that we have circulating here in the United States.
I absolutely get it. Science evolves. That's important. We learn new things. But she didn't say that. She said, we're sure. We're sure is what got so many people to go out and get vaccinated. Do you think government officials have struggled in communicating why and how things have changed? And in doing so, combine that with all the actual misinformation out there, and it ends up undermining credibility.
It is a struggle. And I think people have tended to say if the government public health officials change their recommendation, that they must have been wrong to begin with. Rochelle was not wrong in May. We had very little Delta variant at that point. Things were on a very good pathway. There was no reason to actually project that by August it would look like it does. You know, I made this point yesterday with Ali Velshi. If you're in the stock market and your stockbrokers told you last week to buy and this week to sell, you don't say, oh, you're a flip-flopper, make up your mind. You say, okay, what's happened here? What are the economic conditions that would cause that to change? That's what's happening with public health. So give the public health people a break. They're trying to look at the current circumstance, do the best they can with a cloudy crystal ball, and tell you what makes the most sense to save lives. And to have that turned into one more reason reason for political criticisms is just not helping at all.
No, the concern is that it's making people tune out because while stocks are important, they're not lives. The Delta variant made up just 3% of COVID strains in the United States back in May. Today, it's 80%. To be clear to the millions of people who are watching, if we are vaccinated, what is the risk for us from this Delta variant? How sick can we get?
Well, here's the good news. In the midst of all this troubling news, the vaccines that are approved in the U.S. are incredibly effective against severe illness from the Delta variant. You have a 25-fold increase in your protection compared to an unvaccinated person. That's why all the people you're hearing about in your reports who are hospitalized are the unvaccinated, because the vaccinated folks are not getting that sick. You can still get infected and maybe pass it on to somebody else without any symptoms. That's what we learned from Provincetown. But you are protected against the thing that people are really worried about, being in the hospital, getting in the ICU, or dying of this disease. These vaccines are working. Please, people, don't make a mistake here in mixing up the news of the last week to think that somehow our vaccines are not successful. They are incredibly effective and safe.
You just have to take them. One thing that's concerning so many of us who are vaccinated, people in our family who aren't, are kids under the age of 12. When do you think those kids are going to be able to start getting vaccinated? We want them to. Safely.
Well, both Pfizer and Moderna started their trials on kids under age 12 back in March, but you need to have safety data over several months before you can make a judgment. So that data is probably going to be in hand by September, but then FDA will need to review it. So sometime in the late fall, winter is probably what we're talking about. And I know that's not the answer people want, but for kids, I think everybody also wants us to be really sure that this is working the way you want it to, because children aren't just, small adults. They're a little different. You got to get the dose right. So for meantime, kids under 12 are continued to be vulnerable, which is why the recommendations are going to be right much there, that schools will need to be in session. That's critical. And kids will need to be masked if they're under 12 in order to avoid the further transmission of this Delta variant just at the moment that we want to try to stop that.